Hi, I'm Dr. Miranda Tan. I'm currently Clinical Associate Professor at Stanford University School of Medicine. I previously treated patients with liver disease and liver cancer when I was the founding director of Sleep Oncology Program at Memorial Sloan Kettering in New York. Currently, I'm board certified in pulmonary critical care, internal medicine, and sleep medicine, but I am focusing more now on sleep medicine because I realized through time that the best way for us to live our lives is through sleep. And I want to help my patients achieve the best sleep that they can. Sleep is vital in maintaining our cognitive function, maintaining cardiac health, mental health, and also it gives us the energy that we need to get through the day. When our body gets a good night's rest, we feel refreshed and ready to conquer the day. On a physiologic level, our body was able to restore our natural processes overnight. Stress, anxiety, depression, poor sleep habits, and undiagnosed sleep disorders that may be pre-existing can affect our ability to both stay asleep and fall asleep. The National Sleep Foundation and the American Academy of Sleep Medicine recommend sleep over 7 hours. So specifically, older adults should have sleep between 7 to 8 hours, and adults in general should be sleeping 7 to 9 hours. The time that we spend in bed between when we start sleep and then when we wake up from sleep, let's say that's like 7 to 9 hours, right? But then when we wake up in the morning, we don't feel refreshed, that's not a good 7 to 9 hours. So the underbelly of that could be, do we have a sleep disorder that was not investigated? Do we have a lot of stress or anxiety that's causing us to have arousals overnight, which thereby will affect our sleep quality? First of all, we always want to ask about their sleep routine. So what do they do before they get to bed? What's their usual habit? Afterwards, we want to know if they're waking up in the middle of the night, what's causing them to wake up in the middle of the night? And then what are they trying to do to remedy the situation? Are they lying in bed, ruminating about their inability to fall asleep? Because then that change in psychology affects our relationship with the bed. When we talk about sleeping, we mean falling asleep within 20 minutes and staying asleep throughout the night. The best technique to use to help people fall asleep and stay asleep would be sleep hygiene techniques. So sleep is both a physiologic process as well as a behavioral process. So the physiology of it is we have our own circadian rhythm when we know when to fall asleep. And in terms of the behavioral process is for us mentally and subconsciously be aware that the bed is our location to sleep, not do anything else. That includes worrying, being stressed, or getting into bed and using our phones. Another good habit is to create a routine for yourself, waking up at the same time, going to sleep at the same time. So what I usually recommend is creating a buffer zone about approximately 1 to 2 hours before we want to go to sleep. What that buffer zone does is it helps us dissociate our day from our sleep. So during that time, we should be really trying to rest and relax. Maybe a warm bath will help, a warm cup of milk, anything to help us be calm before we go to sleep. Another tip would be to make worry lists during the day, not at night, because we're already going through a lot. So we shouldn't be carrying these worries with us and like ruminating over it while we're trying to get to sleep. Another thing is, if once we're in bed and we can't fall asleep in what feels like 20 minutes, we should just get out of bed and do something boring. It shouldn't be a place where we're thinking about, I'm not being able to, I can't go to sleep, or I'm so stressed that, I don't know where my cancer is going, etc. It's not easy to go through cancer. It's certainly not easy to go through the therapies. So the first thing we have to recognize is that if we're going to worry, and we have every right to worry about our disease and our therapy, we should address that during the day, not before the few hours right before bedtime, because then we're going to carry our stress to sleep with us, and it's going to affect our sleep overnight. The second thing is, if we're in pain, talk to your doctor about it. This way, the pain won't affect you when you're sleeping at night. And then third, if you're trying to take all the steps and be diligent about your sleep hygiene technique and your routine before bedtime, but you're still having sleeping problems, go go talk to your sleep specialist because they can maybe look into it further and uncover if you do have a sleep disorder that's present. Another good tip would be to try to create a good sleep environment. So meaning that remove the pets from the room, and I know that we all love our pets, but sometimes they might disturb us at night. Making sure that we have dark curtains because the sun can wake us up earlier than we intend to, and also try to make sure the environment is nice and quiet. Next, no electronics in the bedroom. This might be hard. People like to watch TV in bed, people like to use their phone in bed, but the reality is that we're making the bed another place to do another activity when it should strictly be for sleeping. Another tip would be no clocks in the bedroom, okay? So if you don't know what time it is, just set an alarm for the morning. If you're awake and that alarm doesn't go off, you have to go back to sleep, okay? It could be 15 minutes before the alarm is set to go off, but this is the best way for you to be relaxed and just focus on sleeping. First step is we love coffee. I love coffee myself, but coffee or any type of caffeine should not be consumed after noon. And this is because after that 12 p.m. cutoff, there is some form of caffeine that lingers in our system that may not be metabolized by the time we want to go to sleep. So that caffeine in turn can affect our sleep architecture. The second thing is when we want to eat dinner, we try to keep it light because we want to give our body time to digest, because otherwise when we go to sleep, what ends up happening is that it'll affect our quality of sleep and may cause us to wake up in the middle of the night. What exercise does is it gets us into a regular routine, and our body loves routines. Starting from childhood, routines help. So if we tell our body, okay, I'm going to exercise every day around this time, then the body gets into a regular circadian rhythm as well and can incorporate that exercise. Exercise also gets us tired in a good way. So it gets us energized initially, but it overall will get us tired enough that we will have that urge and drive to go to sleep when we want to go to sleep. Exercise is great because what exercise does is, it puts us in a rhythm every day and it gets our blood flowing and it makes us feel better. It has impacts on our mood, our sleep, our daily functioning. The only con is that we do exercise too close to when we want to go to sleep. So in general, we like to recommend exercise at least 4 hours before when we want to go to sleep. For those that be more sensitive, try to do it at least 5 hours before you want to go to sleep. In regards to blue light, what that does is it suppresses our pineal gland from secreting melatonin. And we need our melatonin to help regulate our circadian rhythm. So if we're watching too much television, if we're on our phones, if we're on our iPads or whatever tablet that we have, we don't realize it, but there's blue light that's constantly being emitted. And thus, not only is it stimulating us, it's also creating a physiologic effect where it's harder for us to get to sleep. So if there are blue light applications on your phone or whatever electronic device you have, I highly recommend using it in the evening hours, at least 3 to 4 hours before you want to go to sleep. If we are very diligent about our sleep hygiene techniques and we still find that it's difficult for us to either stay asleep or fall asleep, it's best to be evaluated by a sleep specialist to see if we have an underlying sleep disorders that can be investigated and treated. Patients can find a sleep specialist either through their primary care physician or by asking their oncologist. People can learn more about sleep at the American Academy of Sleep Medicine website.